Dr. Andre Matthew, a general practitioner, expressed frustration over the challenges healthcare workers face, emphasizing that medical professionals are often forced to prioritize patient care over their own well-being. He noted that when doctors feel compelled to leave the profession for their own survival, it is a clear sign that the system has failed.
We're probably one of the professions where we're just happy that we earn the salary at the end of the month, but what we're most concerned about, right, is the patient in front of us at every moment. You know, our own well-being, our own health is secondary almost all the time, Tim. So for a doctor to start saying, no, it really is not making sense. I have to leave here to keep myself alive and well, to leave a hospital for that reason, it tells you that the institution has really failed its mandate. There's a complete overhaul that's needed.
One of the key issues he highlighted is the hospital's poor communication practices, which he believes contributes to patient dissatisfaction and confusion. According to him, many patients leave OKEU feeling frustrated with their treatment experience, not because of poor medical care, but due to a lack of clear explanations about their diagnoses and procedures.
OKEU has a terrible communication problem. Tim, I have patients who leave OKEU and they come to me with the forms, and I must say, first of all, the forms are not very good. They're what they get when they're discharged. Sometimes you could barely make out what's there. I can see that St. Jude's Hospital has done better than that. But they come to me and they're unhappy about the service that they got. When I go through the form, Tim, and I explain to them what happened, what they were diagnosed with, why the treatment, because it makes sense to me. I'm looking at it and I'm saying, but the doctors did a good job in my opinion. When I look at it and I explain to them what happened, everything is good, everybody's happy. So the communication that's happening at OKEU is terrible from all what we can see, and it's not simply the patient-doctor relation there, or interaction. It's from getting to the hospital, from getting clarity about what's happening, why there's a wait, why you're there 5 hours. Communication is huge.
Dr. Matthew also pointed out broader systematic failures within the healthcare sector, citing issues such as overwhelmed hospitals, inadequate infrastructure, and the lack of proper regulations and institutions to support healthcare professionals. He urged citizens to recognize their role in helping reduce strain on hospitals by making better lifestyle choices and being more responsible on the roads.
Because if you're on the John Compton Falling Highway there, and you're driving at more than 50 kilometers per hour, you are speeding. I said 50 kilometers per hour. When I drive at 50 kilometers per hour, Tim, I'm like a grandfather on the road, you know, people to me, get out of the way, you know. But that is the speed limit for there. Whenever you're speeding, what you're doing is creating the likelihood of an accident. You cause an accident there, these people go to the hospital. Tim, the next person who came in with a heart attack, with a stroke, with whatever, they're dealing with that, you know. That's the delay. So instead of people pushing you out of the way, what we need to start doing now is telling everybody, hey, cool out, because if I go to the hospital there, bring my child there, whatever, I need them to get cared for in a timely fashion. Whatever we can do to keep ourselves well, we should do. We are overwhelming these institutions. It's not fair.
When asked about what immediate changes he would make as a health minister, Dr. Matthew stressed the need for policy-driven reforms and stronger leadership to guide the sector in the right direction.
Our CMO, just to add to the list, is another one who's a wonderful practitioner. But the CMO's work is very much determined by what the minister sets, you know. What the minister sets as his agenda, what he sets as his plan, his policies. There are many things that need tidying up in the healthcare system. And it starts from the laws. It starts from some of these organizations that need to be established, that are on the books, but are not happening. They don't exist.
The doctor's concerns come amid growing frustrations among healthcare professionals and patients regarding the state of St. Lucia's healthcare system. His call for urgent action underscores the pressing need for better communication, improved hospital efficiency, and stronger leadership to address the challenges plaguing the sector. For the DBS News World, Manasseh Stanislas reporting.